Hi there, my name is Nicole, and today we're going to be doing a physical assessment video for Santa Ana's School of Nursing. So first thing I'm going to go do is check the medical order and make sure that whatever the doctor has put in for me to do, that I'm doing the right thing. So today is a physical assessment, so let's go ahead and get started. Alrighty, so I'm going to enter the patient room and I'm going to go ahead and perform hand hygiene. Making sure that if I need some certain PPE for the patient, that I would have it, if it was like a C. diff patient or a droplet, whatever it is. So PPE, correct PPE. So now I'm going to go ahead and provide patient privacy, and let's go ahead and introduce myself. So, hi there, my name is Nicole. I'm going to be your nurse today. Can you go ahead and please tell me your name and your date of birth?
Yeah, Casey Gackman, April 3rd, 1992.
Sounds great. It was just your birthday a few days ago. Happy belated birthday. So let's go ahead. So Casey, today I'm going to be doing a physical assessment on you. Pretty much just making sure everything is good. Can you go ahead and tell me, do you know where you are?
Yeah, at the hospital.
Okay, and do you know why you're here?
I just had a headache the past few days.
A headache, okay. And do you know what year it is?
Yeah, 2020.
Okay, sounds great. So I'm verbalizing right now that my patient, she knows she's alert and oriented ×4. She knows her time, place, situation, and who she is. And then she also doesn't look any signs of distress. Her skin doesn't look super flushed or anything like that, or super red either. So now I'm going to raise the height of my bed, making sure it's at a comfortable working position, so up to the hips. And then I'm going to go ahead and start. So now we're going to go ahead and just check the head. Any pain at all, Casey? Like any pointed pain at all?
No pointed pain, just overall pain.
Like an overall pain?
Yeah.
Okay, from the scale of 1 to 10, 1 being the lowest and 10 being the highest, what's the level of pain?
Probably like a 7.
Like a 7? Okay, so we'll make sure that we get any medication that might help with the pain later on. Alrighty, Casey, so now I'm going to go ahead and just check with the light, just behind the ears a little bit, making sure that there's no cuts or anything like that, or super dry areas. Looks really good. I'm going to just check for your pupil reaction, so go ahead and just, perfect. Okay, perfect. Her pupils look, both are reactive, they're both equal, and they're reactive to light. Okay, so I'm going to just check. So her eyes, the sclera of her eyes look nice and white, so there's no sign of like jaundice, for example. No yellow in the eye, so it looks nice and healthy. I'm going to check for the nose. Okay, good. Open your mouth real quick. Good. She doesn't look like, her mouth doesn't look super dry. If it was, I would probably make sure that she's well hydrated after. And yeah, okay, so let's go ahead. I'm going to go ahead and raise the bed to 30 to 45 degree angle, just to check jugular vein distension. So right here, if it was super prominent, it would probably indicate maybe some hypotension, some, it would mean maybe she has some sort of issue with overhydration or something like that. And if it was super sunken in, it would mean maybe she is dehydrated, or yeah. So we're gonna go ahead and check. Yep, looks good. Okay, so we're gonna go ahead and check just the tugger of her skin. It looks like it's bouncing back nicely, so looks like she's well hydrated. So Casey, right now we're gonna do your lung sounds. So just go ahead and breathe at your pace, and then I'll just let you know when we're done, okay?
Okay.
So just go ahead and start breathing for me. Okay. Okay, and I'm just going to check down here. Okay. Alrighty. Her lung sound strong, and doesn't seem, I don't hear any like stuff in her lungs, like rails or rhonchi or anything like that. So Casey, I'm going to go ahead and check your heart sounds as well, okay?
Okay.
So this is our aortic heart sound. Then I'm going to do her pulmonic heart sound. Okay, tricuspid. Okay, and her mitral. Okay, perfect. If this was a real hospital setting, I would go ahead and obviously put the stethoscope on the actual skin. Alrighty, Casey, everything sounds great. Her S1 and S2 are present. They sound regular. It doesn't sound like it's super bounding or anything like that. So Casey, I'm gonna go ahead and now check your arms. Any pain at all in your arms, Casey?
No.
It doesn't seem like there's any pressure ulcers on her bony prominences here. To touch, her skin feels nice and it doesn't feel like it's super hot. Doesn't feel like clammy or anything like that. It doesn't feel super dry, but it doesn't feel clammy. So I'm gonna go ahead and check her radial pulses. Not with my thumb. Alrighty, perfect. They feel nice and equal. I would say +2. Casey, can you go ahead and pull for me? Perfect. Now go ahead and push. Sounds great. And I'm going to go ahead and just check for cap refill. Okay, it is under 3 seconds, so we're good. Just checking skin tone here. It's not tenting. If it were, again, it would be a sign of dehydration. Now I'm going to go ahead and check for, I'm just going to go ahead and look at the stomach and just first visually see if there's any distension at all or any like super like contoured area. Looks good. So now I'm going to go ahead and just palpate. So any pain at all, Casey?
No.
Anywhere here?
Mm-mm.
Okay. How about there?
No.
Sounds great. So now I'm going to go ahead and just here for bowel movements. Okay. Perfect. Perfect. Everything sounds great. Casey, when was the last bowel movement that you had?
Last night?
Okay. And then was it normal for you?
Yep.
Nothing irregular? Okay, perfect. And then any, when was the last time you urinated?
This morning.
Okay, perfect. And normal, everything was good? Okay, and your last menstrual cycle?
2 weeks ago.
Okay, perfect. Everything normal there?
Yep.
Awesome. So from there, I would go ahead and check her peri area, make sure everything's good. If she had a Foley catheter, I would look at what, how much, the volume of what, was outputted. I would look at the color, if there was a certain smell or anything like that. So I would just make sure I'm looking at her Foley. From there, I'm going to go ahead and uncover her legs real quick. So I'm going to go ahead and just check her legs. Any pain at all, Casey?
No.
Perfect. Okay. Any pain there at all?
No.
Sounds great. So Casey, now I'm going to go ahead and ask you, can you go push down? And then push upwards. Can you wiggle your toes? Can you move them side to side, your whole legs? Perfect. And can you raise your legs? Perfect. So she has, I would say, a +5 for both her upper extremities and her lower extremities. I'm going to go ahead and check for her dorsal pedialis pulse. Okay, perfect. So I can feel those. This is her posterior tibialis pulse. And then she has her popliteal, her femoral are right here. She has her brachial, and then she has her radial, her carotid, and her temporal. So I would just make sure if I couldn't feel the ones here, I would just go up in order from toes to head. Alrighty, Casey, so now I'm going to go ahead and ask you, are you able to get up by yourself and sit up? Perfect. So let's go ahead and I'm going to go ahead and listen to the your lung sounds from your back. So just start breathing, and then I'll let you know when we're done, okay? So go ahead. Perfect. All right, perfect. So I'm going to listen to, so on the front I listen to 6 lung sounds, and on the back I listen to 8. So now I'm going to go ahead and just look for any, I'm going to look, the alignment of her spine looks good. any bony prominences, I would just check for pressure ulcers, skin integrity overall. Her skin looks good. Nothing seems to be like any pressure or ulcers or DTIs or anything like that. Casey, can you go ahead and just lay on the side real quick, on your side? Perfect. So I would go ahead and check the patient's back of like her buttock area, make sure there's no pressure ulcers on like the coccyx or anything like that. Make sure its skin integrity is good there. Make sure that the back of the leg is good. Any pain at all?
No.
Okay. Her heels look good. Doesn't look like it's any concern for pressure ulcers. If there was, I would make sure that I would elevate her, you know, whatever it is that seems to have pressure ulcers, or put a pad under it or something like that. Alrighty, Casey, everything looks good. Skin integrity looks good. It doesn't seem like she has any pitting edema. Bounces right back. Looks good. Alrighty, Casey, so can you go, are you comfortable? Let's go ahead and get you in a comfortable position real quick. Okie dokie. So make sure that she's good. I'm also going to check for if she has like IVs or anything like that in her arms, or any other tubing, like a chest tube, just to make sure everything looks good, draining good. I would look to see if the IV area is patent, and if it wasn't, then I would obviously have to fix that. Anything else I can get you, Casey? No? Okay, so here's your call light. If anything comes up, or if you need anything at all, just go ahead and you can press that button. I'm going to now lower the bed just to make sure that she is in a safe position. So I'm going to lower it, and then I'm going to put just the side rails up. I can do 3, not 4 though. And then from there, I'm going to, anything else, Casey, at all?
No, that's okay.
Sounds great. So now I'm going to perform hand hygiene, and from there I'm going to document my findings to, and just, yeah, document my findings. Perfect.